Hello students, today's topic is pharmaceutical dosage form. So what are pharmaceutical dosage form? Dosage form is defined as the physical form of a dose of a chemical compound used as a drug or medication intended for administration or consumption. And what are the need of dosage form? In order to provide accurate dose and in order to protect the dose by coating the tablet scaled ampules, protection from gastric juice, to provide masking taste and odor, placement of drug within body tissues in order to provide sustained release medications, controlled release medications, and optimal drug actions, insertion of drug into body cavity such as rectal, vaginal, use of desired vehicle for insoluble drugs. So dosage form can be classified under four categories: solid, semi-solid, liquid, and gas. In case of solid, it is further divided into two types: unit solid and bulk dosage form. And in case of semi-solids, it is divided into cream, paste, gel, and suppositories. And liquid dosage form is classified into two classes: monophasic and biphasic liquid dosage form. And gas, in case of gaseous dosage form, it is categorized into inhaler and aerosols. First of all, we would study about solid dosage form, and under this, unit solids. Example of unit solid is tablets. They are a unit solid dosage form consisting of active ingredient and suitable pharmaceutical excipients. They may vary in size, shape, weight, hardness, thickness, and disintegration properties and dissolution characteristics, and in other aspects. For instance, paracetamol 500 mg, ibuprofen, and many other tablets which are available in the markets. And second unit dosage form is a capsule. They are unit solid dosage form consisting gelatin shell that breaks open after the capsule has been swallowed and releasing the drug. And capsules are further of two types: hard shell gelatin capsule and soft gel uh, shell gelatin capsules. Now next is bulk dosage form, under which it powder. They are bulk solid dosage form consisting two or more medicament for internal use. The size of particle range from 10,000 microns to zero point 0.1 microns. Size of the powder determines the effectiveness of physiological properties. For example, Nibanol 10 mg. Next is dusting powder. Dusting powder is a powder used as a desiccant. The pharmaceutical use of talc as a dusting powder depends on its desiccant properties. Dusting powder is a powder used as desiccant. Next is semi-solid dosage form, under which creams comes. Creams are semi-solid emulsions, that is mixture of oil and water. They are divided into two types: oil in water type and water in oil types. Oil in water creams, which are composed of small droplets of oil dispersed in continuous aqueous phase. And water in oil creams, which are composed of small droplets of water dispersed in continuous oily phase. Water in oil creams are more difficult to handle. Next is ointment and paste. Paste are semi-solid dosage forms that contains one or more drug substances intended for topical application. Generally, paste contains a higher proportion of solid materials than ointments. Next is gels. A gel is a solid or semi-solid system of at least two constituents consisting of a condensed mass enclosing and interpenetrated by a liquid. For example, Orogel 5 gram. Next is suppositories, which also comes under semi-solid dosage form. A suppository is a solid dosage form that is inserted into the rectum, vagina, or urethra, where it dissolves or melt and exerts local or systemic effect. Suppositories are used to deliver medications that act both systemically and locally. Next is liquid dosage form, under which we would study only monophasic liquids, and biphasic liquid we would study in next lecture. And under monophasic liquid, example is syrup, and it do not contain alcohol and are concentrated solution of sugar, water, and flavorings. They are sweeter and more viscous than elixir. Most over-the-counter cough medications are syrup based and do not only carry the drug but also act to soothe the inflamed mucous membrane of the throat. For example, Tusca Plus. And another example of monophasic liquid dosage form is solutions. One homogeneous phase prepared by dissolving one or more solution in a solvent.